You are watching a recording of a training webinar about how to conduct a systematic review. This webinar series was developed by the Impact Research Programme in partnership with Cochrane Common Mental Disorders and Cochrane Global Mental Health.
I'm really happy to introduce session 5 of our systematic review webinars today, and today's topic is going to be study selection. So I know you've had 2 in-depth sessions on searching with Judy over the last couple of weeks, and today my colleague Nortje is going to talk you through the next step in the systematic review process, which is study selection. Same pattern as usual, just a quick welcome at the start, and then Judy is here again today to go through the homework from last time, and then Nortje will set off with talking you through some of the methods and considerations for study selection, and she will also finish on a little bit of an introduction and a sneak peek to next time when we will be talking about data extraction. And as always, we will then finish off with the homework. So I'll hand over to Nortje now to get us started on study selection.
Thank you very much, Jen. So welcome to everybody from me as well.
Good morning, everybody. The homework which I set after the last session was looking at a search strategy which I'd written, which was about looking for trials of schizophrenia and smoking cessation. So it was following on from the example we were using in the session. And there were some mistakes within that search strategy, and I wanted you to have a look and see what you could find. There are actually 5 different mistakes in there, so I'll just go through them, but it would be interesting in the chat if you could, if you did the homework, if you could say if you'd actually found them or not, or if you'd seen anything else. So the first mistake I made was on line 3. So on line 3, on the original search, I'd said search for number 1 and number 2. And what that was doing, it was asking the database to find all the records that had the word schizophrenia in, but also those records had to have the word psychosis in, or hallucination or delusion. So that made a very small set of results. Because there weren't many, there was 43,000, but there was which is quite a small number of references. And what we really wanted to do was ask the database to find all the records that had either the word schizophrenia or schizophrenic, or the words psychoses or psychotic or hallucination. So that was a key mistake where I'd used the wrong Boolean logic. I'd used and instead of or, and you can see on the sort of the blue column that the correct search found 245,000 and the incorrect one had only found 43,000. So we lost a lot of relevant studies at that point. The next the next mistake I made was on line 7, where I misspelt the word cigarette. I hadn't put in 2 T's, and with the mistaken word, it only found 1 reference, whereas with the correct spelling, it found 7,000. So again, you can see a really big difference. These are very, very easy mistakes to make, and this is why it's helpful for somebody else to always look at your search strategy so you can check what's going on. The next mistake was on line 10 and line 11, similar mistakes where I didn't put in a truncation symbol. So the little star that I add tells the database to find any records which have the word which begins with e-cig, so that's going to pick up e-cigarette and e-cigarettes or e-cigs, and the same with the e-cigarette star. The star will pick up the plural, so it adds. I mean, it doesn't add a huge number, but it does add a few more if I can pick up the plurals. And then the final mistake was actually on line 14, and on this line, I'm trying to group together all of the different terms that I've got for smoking cessation. So I'm saying to the database, find me any record that has the word smoking cessation in, or tobacco cessation, which is line 5, or quit smoking, which is line 6, and so on. And I'd forgotten to put the last line on, so I hadn't included line 13, which was nicotine gum. And again, this is quite a common mistake when you're putting lots and lots of different search lines together, lots of numbers. So in this instance, the incorrect search line found about 40,000 results, whereas the correct search line, when I'd included the nicotine gum, founded 56. So all in all, I kept losing possibly relevant results as I was making these mistakes. And the final, I haven't, because the searches are very long, it's hard to show it on one screen. The final bit of the search was about trials, and then combining the trials, the smoking and the schizophrenia together. In the search which had the mistakes in, we only found about 29 records, whereas the corrected search found nearly 200. So you can see there's a really big difference there.
Judy, there's a question, just like you've truncated SIG, can you truncate nicotine with an asterisk, and then that would cover both nicotine gum and nicotine patch?
Yeah, you could. I mean, nicotine with an asterisk is just going to pick up anything with the word nicotine in. So it will pick up nicotine gum, nicotine patch. It'll also pick up the substance nicotine. So it might find studies which are about nicotine but not to do with stopping smoking. So you would get all those interventions, but you might get a lot more as well. The nicotine star just will affect that word for nicotine, so you get nicotine with the plural of it. I can't think of anything else that begins with those words.
So it wouldn't actually pick up nicotine gum if you put nicotine star only, because it's two separate words, isn't it?
It is two separate words, but if you hadn't got the gum next to nicotine, if you just search nicotine instead of nicotine gum, it will pick up any study which mentions nicotine, and the gum could be there, the patch could be there could be any word next to it.
Mm-hmm. Okay, but the truncation, the star.
Yeah, that won't really affect, yeah.
Yeah, because that's more a sort of shortening of the word.
Yeah.
So is there any advantage searching for nicotine gum as opposed to nicotine just by itself?
I suppose it's if there are studies where the nicotine isn't a part of the intervention, because what we're trying to find here are interventions that stop smoking. And if we just search for nicotine on its own, we might find a lot of studies about, I don't know, nicotine addiction, which maybe are not about interventions for smoking. But it's something that you would test, because I would think it probably doesn't make a huge difference if you, within that search, if you just had nicotine on its own. I would perhaps test it with just on its own, nicotine just on its own, or nicotine with some of these intervention terms like gum and patch next to it.
Thank you, Judy. Okay, we'll continue. Nikki just told me my sound is not very good, so I'm leaving my video off, and I hope that that's better for you. So today we are talking about study selection and a little bit about data extraction, but just an introduction really. And you'll see that when we start talking about study selection, the other previous phases become really important, especially the development of the protocol that you've discussed before. I've listed the learning outcomes for you here so that you can check whether you know and can do all of these things at the end of this session. So you'll get an idea of the different software that you might use to do study selection. You get an understanding of the importance of the protocol and being able to go through the study selection process smoothly. You'll be able to create a brief summary of the selection criteria from the protocol that you can use to do your study selection. Understand the process of the title and abstract screening and the full text screening, and recognize the key elements of data extraction as an introduction. So when you get started with the study selection, there's a few things that you need to do first. You start by uploading the references that you got from your search. And you might do this in different software, and I'll give you a brief overview later of the software that you might be able to use to do that. And what you will do is you'll have the citation, and with that the titles and the abstract of each record that you found. And those are going to be used to do this, the first stage of the screening. Now, if you've used multiple databases, and you probably will have done, then some records will be duplicates. So some databases will pick up the same records, and you need to get rid of those that are the same. And the software that you will use will generally help you to do that. So whether it's an EndNote or any other screening software, they will have an algorithm that finds the duplicate studies. It's not 100% foolproof, so they will still have some duplicates in, because if there's really small differences in the titles, for example, or the names of the journals, then the software might not realize it's a duplicate, so you will still have to get rid of those later. The other thing that you need to think of before starting the study selection process is who is going to help you to do the screening. So I just wanted to ask all of you, how many reviewers you think you might need for this study selection process? Whether it's at least 2, at least 3, or you're not sure. Okay, so we can see that most people said you need at least 2 reviewers to do the study selection or screening. Some people said at least 3, and a few were not sure. It will depend a bit on the type of review you're doing and how many resources you have, of course. If you can, then it's best to have at least 2 reviewers. More is always better, so especially if you have a lot of studies. It's helpful to have more, but it would be best to have 2, and it's good to have a mix of people as well. So there might be people in your team or who can help you out with the screening, who have more expertise of the systematic review process. There might be people who have more clinical expertise, and a combination of that is often useful. Ideally, you will want to have records screened by 2 people, so you need at least 2 for those, and we'll see later on why 3 is actually a good idea if you can. What is really important when you get started, and even before you get started, is that you keep track of the process that you're going through with your studies. It's really hard to do this afterwards. So you'll get a number of records from the search, and you'll narrow that down gradually as you go through the review stages. At the first stage of the screening, you'll get rid of some that are not relevant. At the second stage, you'll get rid of some more. And you'll end up with your final set of included studies. Now, they might come from different databases. You might have duplicates in there that you need to remove. It's really hard to track back and try to figure out what you did at every stage. So it's good to start this as early in the process as you can. And most people use a Prisma flow diagram, and you can download one from the website. You can use this template to make your own, but it's a good idea to do something like this. And what you see is on the left-hand side, the blue boxes are the different stages of the review. And for each stage, you list the number of records that you found and how many there are at each stage as you go through the review. It's important to note that on the first half of this diagram, you'll see that it talks about records that you've identified. And then on the second half of the diagram, it talks about articles and studies and the number of studies that you finally included in your review. Now, this is because records and studies are not necessarily the same thing. You can have multiple records that all belong to the same study. So for one trial, you might have a protocol. You might find an abstract of a conference that the authors have submitted the abstract to. You might find the study results. You might find a follow-up study. So there could be 4 or 5 papers associated with one study. In the end, you want to know what the number of studies was rather than the number of records that you've included. So this is a way to give readers an overview of that. The purpose of the title and abstract screening is to select those records which look like they might be relevant to the review, and to remove any records that are irrelevant. And you will look back to the protocol here to see, especially the selection criteria, to see what the scope of your review is. And This will also be reflected in the searches that you've done at this stage. So you need to know who will you include in terms of the types of participants, what the intervention is that you're interested in, comparators. You might select studies based on outcomes, or you might not. You might accept any outcome, and the setting. And there might be additional bits, but for the title and abstract screening, you won't need too much detail yet. So for example, the title of this review might be CBT for depression in adults with diabetes in lower middle income countries. Now that tells you who you are looking for, what type of treatment. You might still have to go back to the protocol to check a few things. For example, are all types of comparators included? What sort of studies are you including? Only trials or different types of study designs? And it's a good idea when you start screening to have a very short, brief overview of the selection criteria that you'll be using. Now, sometimes you'll find that it should be the case that this is all in your protocol. And if you've done a good job with the protocol, this is where it really pays off, because you'll be able to find exactly what you need in there, and you'll go through the screening really quickly and really smoothly. Sometimes you'll find out that there's information missing, that you don't know what to do with certain studies. So you might have to make changes to criteria, or more often add something to it, add some explanation. Now, I think you will have discussed in the first session that it's always better to stick to the protocol, and you want to finalize that before you start doing the review, and then not make any changes. But if you have to clarify a few things because you get stuck with the screening, then make a record of those changes or those additions and make sure that you report them. Ideally, when somebody reads your published review, they should be able to do the screening based on the information in your protocol and in your review. So make sure that it's transparent. Okay, so there's different types of software that we will go through, but for all of them, the basic idea is that you say yes to relevant studies that might be included in a review, and no to those that are not relevant and that can be included. Now, what do you choose if you are not sure whether to include it at this stage based on reading the titles and the abstracts? Would you choose yes or no? Skip this record and go to the next one? Or are you not sure? A lot of people said they're not sure what to do about those records, where you don't really know based on the titles and the abstracts whether to include it or not at this stage. And then most people said yes, they would include and say yes. So at this stage, it's important to get rid of all the records that are definitely not relevant, that don't fit your criteria. And most of those will be very obvious, so you can quickly exclude them. It's also important to be conservative here. So if you think it might be included, say yes for now. And often it's a case when you just have the title and the abstract that you just don't have enough information. And you need to read the paper to know for sure whether it should be included or not. So if you're not sure at this stage, say yes. And that means that that record will go on to the next stage where you have a look at the full text study. And then you should be able to tell for sure. If you can, it's always best for two reviewers to screen the titles and abstracts independently. So that means that each record is screened by two people and that they don't know from each other which choice they make. So you don't do it sitting next to each other, for example. And in some software, it's really easy to have every record screened by two people. Sometimes you might not have the resources to do that. There's other ways of doing it. So you could have one reviewer screen everything and a second reviewer check a percentage of it. But if you can, then they should be done in duplicate. Now, there will always be some records where you didn't make the same choice if there's two people screening. One of you will have said yes and the other one will have said no. And that's normal, and it's to be expected. If it happens for almost every record, you need to have a discussion and find out where you are making different choices. But if it's a small percentage of the total number of records, then you can just resolve those conflicts or disagreements at the end. And there's different ways of doing that. This is where a third reviewer could come in handy, because you could discuss with between you whether it should have been included or not. But a third person might be able to look at those conflicts, and it's good if that person is experienced in doing reviews and if they have a good understanding of the topic or the condition that you are looking at. And they can be the third voter on the record. And it's a good idea here to be conservative as well. So if the third person would still not be sure, or after discussion you're still not sure, then you would include it for now, so that you go to the next phase and you can look at the full text screening. So now you're at the full text screening stage, and hopefully you'll have a much smaller number of records that you need to look at now. Before you can start screening those, you'll need to find them first. So you'll need to have the PDFs or a link online to the full text article. If you work in an organization or university, they probably have, the library probably have a subscription and you can access papers online. And most of them should be found in this way, but there's always ones that are not in there. Some of them also you can just Google and they will be open access, so everybody can access them online. So you can try that as well. If you can't find a record, you might ask your colleagues. There could be other review authors, or maybe colleagues you know in a different institution or at a different university or center. Often libraries all have slightly different subscriptions. So if you know a colleague in a different part of the country, for example, or another country, they will have a slightly different subscription and they might have access to those papers that you can't find. If that doesn't work, you could email the author. There's normally, it might be the first author, it might be a different author who's the contact author for that paper, and you can get in touch with them. And it's normally pretty nice to get a request to share your paper, because it means that somebody wants to read it. So often authors will do that if you can get in touch with them. We'll email you a copy. It's helpful if you set yourself a deadline. So you might say you will contact them twice, or you might say once you get to the next stage of extracting the data, you stop contacting them, or have something in mind, and you can specify this in the protocol of when you're going to stop, because sometimes you just cannot find the full text paper. Hopefully that's a really small minority of the records. It's important to not just exclude those, but to report that they were not available. And you might be able to find them at a later stage or when you update that review in the future. There might also be records that are abstracts for which there isn't a full text record. And in that case, you can check with the author, but if there isn't a full text paper, then you will have said, hopefully in your protocol, what you do with those. So for some reviews, it might be relevant to still include those abstracts. For some, you might not be interested in them. And the same with protocols. It might be relevant to include protocols for which there isn't any data yet, or you might have specified in your protocol that you're not interested in those. Another thing to keep in mind is that if you said you would include studies from multiple languages, then this is the point where you need to find people who will be able to read papers in those languages. And especially in global health research, it's often a very good idea to include papers with other language in other languages. You can ask colleagues or friends who can speak the language if they can screen it for you. At the abstract stage, this is usually easier. You can maybe get away with putting it into Google Translate and including or excluding based on that. But for the full text screening, you'll need someone who is really proficient in that language. So they might be able to screen it for you. You can get someone to translate it, either a colleague, a friend, or a professional translator. But it would be a shame to translate the manuscript to then find out that it shouldn't be included. So it's better to do that after this stage and see if somebody can just screen it for you in the first instance. If you are doing a Cochrane review, there's a platform, an online platform, it's called Task Exchange. And you can go on the website and you can post a task. So say you need the translation or the screening done for a paper in Chinese. And then volunteers on there who are looking to get a bit of experience with doing Cochrane reviews might reply to you and say they are happy to do that for you. And I've had really, really good success in lots of different languages of people screening, translating parts of manuscripts and so on, but it's meant to be for Cochrane reviews only. The aim of full text screening is to select all of those records which match all of your inclusion criteria and none of your exclusion criteria. And at this stage, you really need to have a detailed look at your protocol. And hopefully your protocol will be detailed enough to specify everything that you need to know at this stage. So before, it might have been enough to know that this was a review about CBT for depression in adults with diabetes in lower middle income countries. Now, I don't know if this is hard to do because you're not doing the actual screening for this, but if you imagine that you are doing the screening, you might come across lots of different papers. What else would you need to know to be able to do the full text screening for this, the records for this paper? And can you put some answers in the chat if you have an idea of what else might be useful here? Okay, so there's one answer. I'll continue to not take too long, saying you need to know what types of treatment. So yes, that's a good one. So cognitive behavioral therapy, there might be lots of different types. And you will have specified hopefully in your protocol what exactly you mean and which types you will include in your paper. Also, what counts as depression? Does it count if people report symptoms of depression themselves, or do you want a clinical diagnosis? Adults, is that from 18 or 16? Hopefully that will be in your protocol as well. What does diabetes mean? Is that type 2 diabetes or is type 1 included as well? And what are lower middle income countries? What sort of classification do you use to know whether something is a high income or low middle income country? And then the last question that is a bit more tricky is, what if you do, what do you do if a study has mostly adults but a few children? Is that included or excluded? So you will come across these issues when you do the full text screening. And if you specify in your protocol exactly what studies you are looking for, then that makes it a lot easier, and it makes the agreement between the two of you, the two reviewers, more easy. So you select records which match your inclusion criteria and that do not match any of your exclusion criteria. And sometimes you might see a really interesting study that is relevant for this topic, but it doesn't fit all of your inclusion criteria. What do you do with those? Do you include those for now? Do you exclude them? Or are you not sure at this stage? Okay, so most people have said exclude it, and I agree with that one. Some people have said include for now. You only want the studies that fit your selection criteria, no matter how interesting the others look. And often when you really care about the topic, you will see other studies that look really, really interesting. They can be included in your final set of included studies if they don't fit the selection criteria. What you can do is keep them in a separate folder. So, or tag them as an interesting study. So you might have systematic reviews, for example, that you think would be relevant in the writing up of your systematic review. So make a note of those or save them in a separate document. They won't be in your included studies, but you might still be able to use them in a different way. Again, for full text screening, ideally you have 2 reviewers who screen all the full text papers independently. Again, if this is not possible, you could, for example, have a second reviewer check a percentage of the studies. But if you can do it with at least 2 people. In the title and abstract screening, you just say yes, include, or no, exclude. At this stage, you also say why you want to exclude studies. And it's helpful to have a list, a short list, with the reasons why you've excluded studies. And that just helps with the writing up and filling in your Prisma flowchart that we talked about earlier, because there you will report what the reasons for exclusion were. So for example, a study used the wrong types of participants, a wrong study design, not the outcomes you were interested in, and so on. So there's usually a few common reasons why most of the studies were excluded. Then again, you will have some conflicts. So there will be, the 2 reviewers will have made some different choices in the full text screening. Have a discussion or either use a third reviewer who is experienced in doing reviews and or in the topic. And sometimes you might need to discuss in more detail here, or ask someone for advice if you're not an expert in the topic, on whether it fits the criteria or not. Now, if you made a note of any interesting systematic reviews that you came across, you might use those in writing up your background or introduction, or in a discussion to mention what other reviews are out there and how yours might complement or differ from theirs. And you might use systematic reviews to search the reference lists. So you can have a look and see whether there's any primary studies that they included that might be relevant for your review as well. And you can see whether you picked them up but excluded them for some reason, or whether you didn't find them in your search, and you might still be able to include them if that's what you were planning to do. And then at this stage, I said before that you might have multiple records of the same study. You can link the records together either manually, or your software might allow you to do that, to make sure that you count each study as one, even if they have multiple papers attached with the same study. When I start with a team of people to screen for a review, they often ask at the start, oh, how long is this going to take? And that's a difficult question to answer, because it depends a lot on the number of reviewers. So if you have a big review, then a good idea to get many people involved, what experience they have. And even if you're an experienced reviewer, the beginning always takes the longest, because you have to get your head around your selection criteria, your protocol. Once you get going, often if you have a protocol that is really clear and well specified, the title and abstract screening can be a few seconds per record. The full text screening might be a few minutes per record. But if there's a lot that is not completely clear, it might take longer. And it will depend a lot on the topic. So if you have a very specific topic, for example, a very specific treatment, then you can exclude most records really quickly, because you will see that they are not the treatment that you're interested in. If your topic is quite vague, so for example, at the moment I'm screening for review on mental health promotion, that's quite a vague topic, and there's not one good definition of what is mental health promotion. So I will have to read those records more carefully and those full texts to find out whether it should be included or not. The aim is to do the screening as quickly as you can, so that you can publish the review within a year of running the searches. If you do a Cochrane review, that's a requirement. So if you take longer, you will have to update the searches and screen the additional records that were published in the time that you were doing the screening. And for other journals, especially the better quality journals, or those with a higher impact factor, they will also look at that, and they might often have a similar sort of cutoff where they expect you to publish it within a year after searching. If it takes years and years, it's just not very relevant anymore. So it's a good idea to get on with this stage, do it quickly, get different people involved, and then you can you have your results and you can move on to the next stage. So there's different software you can use, and I'll just give you a really brief overview of some of them. Governance is what we use for Cochrane reviews. The downside is that you have to pay for it if you're not doing a Cochrane review. If you're doing a Cochrane review, you get access automatically. It's very, very user-friendly. Most people find it very intuitive and easy to use. And it takes you through the different stages. So you do study selection, data extraction, and risk of bias assessment, all in the same online software. It's really easy for working on with different people at the same time. And as you can see in the screenshot, there's just the buttons that you can click. I never use the maybe one, but you say yes or no, and it automatically processes those records and also does the Prisma flowchart for you. So it keeps track on how many studies or records there are at each stage of the review. So if I can use it, then that's my favorite option, just because of how easy it is to use. Now, often you don't have the funds to pay for screening software. So Rayan is free to use. It's also online. It's only used for the screening, not for the data extraction, for example. And I won't go into detail. If you want to know more, Jan knows a lot about all the fancy things you can do with Rayan, and it has some really good features that you can use. A downside of Rayan, I think, is that there's no good way to move between screening phases. So for example, to go from the title abstract screening to the full text screening. You can do that, but it just takes a bit more work on your part. But you see that you can label in the screenshot yes or no, or who screened them. You can see the titles and the abstract, so it works in a similar way. And then there's others like the Stiller SR and API Reviewer that are also paid for, but also take you through the whole stage up to and including data extraction. EndNote is for storing reference primarily, but you can use it to code your references. So that means that you can do screening in EndNote, and there's a link to that. EndNote is paid for, but a lot of institutions will have that software available. And then you can use Excel if you don't have anything else available. And obviously you need to set up those forms to be able to do the screening. And you need to find a way, if you're doing the screening in duplicate, to make sure you don't see each other's choices. So you can't work in the same Excel spreadsheet at the same time. You might have to do two separate ones and then merge them together. But it's a good option if you can't pay for the others and you don't want to use Rayan. There's many more tools. I don't know if you've come across this website before, the Systematic Review Toolbox. For every stage of the review, it has a list of software and tools that you might be able to use. Some are paid for and some are free. So there's 39 apparently for screening. So have a look on there if you're interested. I just mentioned probably the main ones that are most often used. I'll really quickly talk through data extraction. And I know this is not enough to get a full grasp of how to do data extraction, but it's just to give you an idea. So again, when you've done your screening, you'll have the set of studies that you want to include in your review. And whatever software you use for data extraction, you'll need a form to be able to collect the data that you're interested in. And whatever software you use, your protocol will dictate what data you want to collect from those studies, because there will be a lot of information in there and not everything is relevant to your review. Again, it really helps you at this stage if you specified already in your protocol what data you are interested in. You can use governance if you are able to use that. You can do it in Excel. You can use Google Forms, or you can copy and paste a form from Excel into a Google form, and that means that you can easily work on it with multiple people and it's online. The example here is just an Excel spreadsheet that we've made ourselves for a review. And you can see you need to have a think about the different formats of the data. So the first column is just free text. In others, we try to use similar categories. And the columns of whether there's a US sample and or a UK sample, we've used 0 and 1 so that you can easily add up at the end. So this will take some time to set this up. But you can do it in Excel, that's fine, if you don't have any other software to use, and set it up in a way that works for you, basically. This is an example of governance, and in governance you can adapt your form so that it suits the data you want to collect. So it automatically gives you the format for a Cochrane review. You can do non-Cochrane reviews in there as well. Then you'll have to make some more changes. It's best suited for studies of intervention. So if you're extracting mostly data on prevalence or burden of disease, for example, you'll need to make more changes to those forms to make them work for you. The most tricky part, I think, about setting up your data extraction is the format of the outcome data, because outcome data can be reported in different ways, and you might want it in different ways depending on what you plan to do with it and whether you plan to do a meta-analysis or not. Governance, as you see here in the screenshot, automatically lets you choose what format you want to collect the data in. So for the first variable here, depression symptoms, it's means and standard deviations. For the second one, it's a percentage. And for the third, the treatment acceptability outcome, it's a number of participants out of the total number in that group. So this will need some thinking, and it might be narrative data as well. So it might just be free text, especially if you're not planning to do a meta-analysis. It will help you if you pilot this form, whatever software you use, with a few studies, because you'll find out that you're missing bits or you want to categorize things differently. So that saves you making changes down the line. Again, ideally you would do this in duplicate, so 2 people would extract the data and then you compare and you come to an agreement. If you don't have time, you can make compromises. One way is that you at least do the outcome data in duplicate, because they're very important for the synthesis of your findings, and it's easy to make mistakes in there. So if you have a typo in an odds ratio or an estimate, then that could change your entire results. So it's good to get someone to extract that in duplicate, or at least to check it. And then if you miss any information, you can contact the authors if you need, say, the standard deviations, for example.
Can outcome be a reason for excluding the study from review?
Yes, that's a good question. So often when you do a review, you are interested in certain outcomes only, but you won't always specify that in the selection criteria. So you might include studies regardless of the outcomes they report. And even if they don't report your outcome of interest, you might still include a study, but then you just don't report the data because you don't have it. So that's your choice, really. You can specify in the protocol that you're only interested in certain outcomes and that you will exclude studies that do not fit those outcomes. So it depends on what you specified in your protocol.
Confidence also say that they offer a different rate for people from low middle income countries. I don't know what that rate is. You have to contact them yourself. So it might be worth doing that just to check.
Okay, I don't see any other questions for now, but I just wanted to say in the meantime that your homework will be on the Google Drive and via email. So it's to have another think about selection criteria and what you might need in there to be able to do the screening process. I see someone is asking about software on the App Store, so you can use it on your phone. So it depends on the software. Confidence, you can do it on your phone. I don't know about Rayan. Jan, do you know?
Rayan does have an app, but it doesn't have the full functionality and it can be a little bit glitchy. But Confidence, you can definitely do. It's not an app, but it's a mobile optimized version of their website. Yeah. But it only works for title and abstract screening, so you can't do full text assessments or data extraction on a mobile device.
No. Yeah, so that's it really.
Just say thank you, Nurche. Really appreciate your time doing this. And thanks to everybody who's joined. See you all next time.
Okay, thank you everyone. See you next time.
Yeah, thanks everybody. Bye.